Thank you very much. I want to thank all of you that have been coming for our training workshops across the country. I want to thank you. For those of you who have been attending our Zoom training, I want to say thank you. And others too that have been coming individually for experience to have a training workshop and experience with us in ultrasound scan. I'm your host, Dr. Feso Sai. I want to talk about prenatal fetal weight estimation in ultrasound scan. Please, if you are looking at watching this video and the video is not a complete one based on the fact that you're using your WhatsApp to watch it, sometimes WhatsApp cuts the video short. So if it's very short, just click my YouTube page, to see the full video of this training you're about to listen now. Just take note. If you play WhatsApp video, it's not complete, don't worry. Go to your YouTube channel, and of course, you check there, you see the complete video that you can watch and enjoy it very well. Okay. Now, we're going to be in Lagos again in the month of November, 14th of November to 18th of November 2002, from Mondays to Friday, 5 good days. Be in Lagos around that time, based on popular demand for a training workshop involving few persons. Okay, so we're going to organize Lagos Executive Ultrasound Training Workshop for medical directors, chief medical directors, and other people that can come that want to have skill in ultrasound scan. Don't worry, there's some certain topics that makes it quite unique as compared to others ones we're doing all the while. You see, whenever we do training workshop, people ask for so many things. They want to learn this, they want to learn. No. You can't learn everything in ultrasound scan, but the one that is focused for that training program or training exercise. Now, in this, we're going to look at the assessment of the thyroid gland. We're going to look at breast ultrasound, scrotal ultrasound scan, umbilical artery and mid-cerebral artery Doppler for assessment of fetal well-being. Then transvaginal ultrasound scan, follicle tracking, and sex selection. Want to have a male child or female child? There's a concept to use in ultrasound scan to do that. It works. I have over 10 years experience, and of course, the results are quite fantastic. Then talk about transrectal ultrasound scan, prostatic ultrasound scan, then sono HSG, assessment of Asherman syndrome, endometrial polyp, tubal patency, then early pregnancy, abnormality, and a host of others. See, you can do some of these things on your own at the place of your office. I'm happy you did. Then if you're having an issue, you can now send for an opinion or for a referral. If you do the patient and you get the result, the patient will be very happy with you. You can do it. Don't worry. We'll have him that we can put him to make sure you get it. Now, look at this. Okay, part of the workshop across the country. Now, my book. Do you have a copy? Get your copy as quickly as possible. Now, I want to estimate the weight of the baby. Yes, this is the commonest method of estimating fetal weight. After baby is delivered, you put the baby on a weighing scale and you check the weight. What of the one that is inside the womb? Is it necessary? Can we measure the weight? Yes, we can measure the weight. Is it reliable? Yes, it's reliable. Is it 100%? No, not entirely 100%. But of course, there's what we call the error margin. But you can get a good measurement as much as you can in ultrasound scan. Now, in talking about fetal weight estimation, we have formulas that are used, different formulas. Okay? Different organizations have their different formulas they use in assessment of the fetal weight estimation. Have Hadlock 1, Hadlock 2, Hadlock 3, 4, and the rest. You can see that in each of these formulas, we have different parameters that are used to measure the weight of the baby. And mind you, for different machines, your supplier may decide to install any of these formulas. In other words, once any formula is installed in your machine, the moment you click on that on that parameter in your machine, it's setting what the weight is given to you. Take, for example, if your machine is installed with Campbell, the moment you click on the abdominal circumference of the machine, of course, it gives you an estimated fetal weight. That's by the wayside. But from a personal experience with over decades of ultrasound scan, I can tell you Hadlock 1 is fantastic and it's wonderful. But you can use the rest and still get good results. But I use the one based on my personal experience. Now, these are talking about the abbreviations on how to understand them. Of course, I think this should not be a problem to all of us here. Now, this is someone I trained all the way in Akwa Ibom State. And this is the machine. You can see in this machine, it was Hadlock 2 that was used. You can see there's abdominal circumference, femoral length, and of course, the biparietal diameter. And now this is the weight of the baby, 2068 grams, which can be converted to what? Kilograms. So you can use any of these formulas, but take note, I prefer to measure it myself to using the machine's estimation. But later, if there's time, I'll explain the reason why. Now, this is the femur. How do you use the Hadlock 1? Get the femur of the baby, as you can see in this case. Then get the length of the femur. Keep the value aside. Then the next one is get the abdomen of the baby in cross-section or transverse section. Then just get a good one. Make sure you get the appropriate one. This is correct. This is correct. This is not true, not correct. And not in the chest, but rather in the abdomen, demonstrating the liver, as you can see here. There's the liver here. Once the liver is demonstrated in full glare, then you are rest assured you are in the right position. Then in measuring the abdominal circumference, after getting a view, you can use the direct method or the indirect method to do that. Now, both of them are okay, but one is faster than the other. The direct method is faster, unlike the indirect method. Okay, this is the indirect method. What you need to do is to get the abdomen cross section, measure the anterior-posterior abdominal diameter, the transverse abdominal diameter, and of course, you add the two times by a constant. That will give you the abdominal circumference, just like what is demonstrated here. All right. Now, you can also use this. You can use the indirect method. Have the ellipse, the trace, the cross, and the spine. Please don't bother about these three. Focus more on the ellipse. That will give you a better and a more convenient way to get it. Now, this is the abdomen in cross section, transverse view. Of course, what you need to do, click on the AC, the ellipse, then take your cursor to one end of the tummy, take it to the other end of the abdomen, and you drag it, as you can see here. You drag it until it entirely encircles the abdomen. Then it gives you what? The abdominal circumference. In this case, you have 25.16 centimeters. Okay? Now, this is the trace method, don't use it. This is a cross method, don't use it. This is spline method, don't use it. I don't want to bother about that. Let's talk about what I think will be beneficial to you. Now, how do you get the weights of the baby after measuring the femoral length and, of course, the abdominal circumference? You can take a clue from the Women's Health and Nutrition Center, WHEC. There's a table they designed which have been very, very useful. You can go to semanticsscholar.org. You can Google on that and you can see some tables that will be very useful to you. As you are doing that, you see that some of these things will be well displayed. Just hold on a little bit for the screen to be displayed for you to see exactly what I want to demonstrate for you to appreciate. Now, let's look at the table. It's an Excel table. That's the Excel table here. Now, this Excel table shows the femoral length against the abdominal circumference, okay? Now, let's see it well focused. That's good. Okay, now, that's it. Now, you can see, this is the predictive plate. No, not this one. Take it down to sheet 1. Okay, good. So, let's go up. Okay, let's take it up and see so that you appreciate. Now, look at this. This is the abdominal circumference. Okay, and this is the what? Femoral length. What you need to do is to crisscross the two of them. Take, for example, what is the weight of the baby? Whose length is the 4 meters and abdominal circumference is 385 meters. Let's crisscross together. This is L. Take it straight. You take it, continue, and you get to 385. So what's the weight? 403. In other words, 4.3 kilograms. So those of you that had the training in Lagos, if you are with this table, no problem. Go to sheet 1. If you click on it, this is displayed. Then you can use it to crisscross and get your measurement. Then after getting the weights that you've gotten, you can now start to compare the weight you have for that expected for gestational age. Take, for example, at 29 weeks, we expect the weight to be 1.4 kg. Okay? At 32 weeks, we expect the weight to be what? 1.85 kg. So when you get the weight, you now compare to that expected for gestational age. And that will give you a more objective assessment of the fetal weights. You know whether the baby is small, whether it's a small for gestational age baby, or it's a large for gestational baby, or in the case of an IUGR, or rather a case of what? Fetal macrosomia. So that's about weight estimation in ultrasound scan. It gives a and makes you, and if you are assessing, making an assessment of the weight estimation, just problem. Once you get value in the 2 to 3 weeks, make a comparison again. You'll be shocked what you see, especially when you are trying to assess for a case of an IGRO scan. Host, once again, Dr. Face, see you in Lagos, and you're happy you did. More comments, any comments, criticisms, and contributions, they're all welcome. Thank you very much.